Hey guys, Nurse Alyssa here. Today we're going to be talking about Edema Wear. But first, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. Edema Wear is tubular compression stockings that provide a mild longitudinal compression of 10 to 20. So this is for a single patient use. They are washable and may be worn for 6 months before needing replacement. There is Edema Wear Light that has a 6 compression, and this is designed for patients that are unable to tolerate the higher compression. But first, before we ever apply compression onto anyone, you're going to complete a lower limb assessment to ensure that they can actually use compression, so the compression is appropriate for them. So we're going to use this for patients who require a mild compression therapy for treatment of venous insufficiency, a mixed arterial and venous insufficiency, lymphedema, and generalized edema. So this can be in the presence of ulcers or no ulcers. And just for some precautions here, so we're going to use the light version of Edema Wear if there's a lot of bony prominences. We don't want tissue damage, so go for the light version if the patient's legs are very bony. The stockings should not slip down or bounce around the ankles because it can cause a tourniquet effect. Contraindications. So we're not going to use in the presence of uncontrolled heart failure. And we are never going to use compression in the presence of a lower limb infection. So if there is a wound that's infected that is not being treated, so if it is being treated, we can use compression. But if it's not being treated or hasn't been treated yet, do not start the compression therapy. Edema Wear does need to be cut to fit the patient. So how we're going to do this is we're going to do it first thing in the morning before the client gets out of bed, when they're still in a lying position. And we're going to select the size based on their calf or thigh measurement. So either this can be worn as a stocking up to just 2 centimeters below the knee, or the top of the thigh it can go up to. So to determine the length, we're going to measure from the base of the toes and follow the contour of the leg up to either 2 centimeters below the knee or to the top of the thigh, and you're going to add 16 centimeters to the overall length and then cut the stocking. So I did add the sizing chart. I'm not really going to go too much into depth into this, but you would just be measuring the biggest portion of the calf or the top of near the groin area to get these measurements here. And yeah, you're just going to line it up. You have the regular and the light, and just go off the measurements here. So we're going to apply the Edema Wear first thing in the morning. You're going to shower or wash the legs first with warm water, then moisturize, allowing the moisturizer to absorb completely before applying the stocking. I always suggest moisturizing because anytime we have any kind of compression on our leg, it seems to get very dry, and dry skin can cause like skin tears. It's not good for your skin. So you always want to moisturize first before applying on your compressions. So the Edema Wear is put on by rolling it up like a sock and applying it to the foot and then rolling it up the leg. So if you're going to the knee, or even if you're going to the groin area, you're going to make sure that you roll the top of it down, making at least an 8 centimeter cuff at the top of the stocking, ensuring that the top of the stocking is at least 2 centimeters or 2 fingers below the knee, so the knee can move properly. And then you're also going to make sure that you smooth the stocking, ensuring that there's no wrinkles or creases in it. To remove the stocking, you're going to roll the stocking back down the leg. You will expect to see cornrows, so you will see the imprints of the compression. This is completely normal. You're going to see this in anybody. And then we're just going to wash up the legs and moisturize them. Now, if the stocking is slipping, what you're going to do is you're going to turn the stocking inside out and reapply it. And then your 8 cm cuff is going to go on the inside of the leg, so right next to the skin. Now, if it's still slipping, you'll probably have to remeasure and go to a smaller size, because sometimes as the edema wear starts shrinking the leg, you might have to go to that smaller size. So these compressions should be worn all day and all night. They should be taken off and repositioned once a day. And if there is any wounds present, just reassess them, make sure that the cover dressing is on well and the exudate isn't seeping through. If it is, you'll have to change the wound dressing. Now for the stocking care, so these are machine or hand washable in cold water. If the stocking is soiled or has lost shape, that's when you should wash them and just hang them to dry. So the patient is going to need a few pairs of these just to allow them to dry, to have drying time. And if there is any blood stains on them, you can always use hydrogen peroxide and that will remove the blood. The expected outcome of the edema wear is that you're going to have measurable improvement in the ankle and calf measurements within 1 week. So the leg should be a smaller size within 1 week. So that's all I have for this video. I'll catch you in the next one.